Lauren.
Hello and welcome to another live broadcast with MedStar Health. My name is Mashan Bowman-Carter, and today I'm joined by advanced heart failure cardiologist, Dr. Samir Najjar, exercise physiologist, Britta Hayes, and Cheryl, a recent cardiac rehab graduate. Today we're going to be talking about cardiac rehab. For anyone who has had a heart attack or heart disease or had heart surgery, cardiac rehab could help. Cardiac rehab plays a key role in recovery from a cardiac event and can boost a patient's chance of recovery and returning to an active lifestyle. So if you'd like to learn more, stick around, share this broadcast with your friends, give us a like to let us know that you're here, and share your questions and comments below. We're going to take some time to answer those as well. So Dr. Najjar, Britta, sorry about that, and Cheryl, welcome and thank you for joining us today. Before we begin our discussion, will you tell our viewers a little bit about yourself? I'll start with Dr. Najjar.
Yes, thanks for having us, and thanks for actually having this really important discussion, and thanks for the listeners and viewers who are following us on this discussion. My name is Samir Najjar. I've been with MedStar since 2009. I'm currently the Chief of Cardiology for the Baltimore region. And prior to that, I was the head of the Advanced Heart Failure Program at the MedStar Washington Hospital Center, which includes patients who undergo heart transplant and those who undergo mechanical heart pumps and things of that nature. So I'm a practicing cardiologist, and I look forward to this discussion. Thanks for having us.
Thanks for being here. All right, you, Britta.
Hi, I'm Britta Hayes. I'm the lead clinical exercise physiologist for MedStar Union Memorial's Cardiac Rehab. Prior to being a lead, I was doing some research at NIH for a couple of years. And then prior to that, I worked for University of Maryland for about 8 years. So I've been an exercise physiologist for a while now.
Great, thank you both for joining us, and thank you, Sherry, as well. We're going to take some time to share your experience a little later in the broadcast, but thank you very much for your time. All right, I'm going to start with Britta. Could you tell us what is cardiac rehab?
Sure. So cardiac rehab is an exercise and education program. First and foremost, it is an exercise program. So when you come in, you'll be doing all kinds of different exercises with us. Cardiovascular exercises, so such as a treadmill, rower, bikes, same things you would see at a gym. We also do strength training, so dumbbells, machine weights, and then we also do flexibility training. Now on top of that, we also do some heart healthy education. So mainly talking about what it means to live heart healthy. So nutrition is a big one. So a lot of people love the nutrition education. We also discuss medication, compliance, side effects to be looking out for. What does the medicine even do for your heart? And then we also talk about stress management, because we know stress does have an effect on the heart. And we want to make sure if you are feeling stressed, anxious, angry, depressed, you have the tools and know the steps to take should you feel those things.
Excellent, thank you very much. Dr. Najjar, who needs cardiac rehab? What types of conditions could this be used to treat?
Yeah, I mean, cardiac rehab is really important for a lot of patients who have heart disease. So anybody who's had a heart attack, anybody who's had angioplasty or stent placed in their heart, anybody who has angina, so when they walk and they get chest pain, and they get cleared by their cardiologist. Also, patients who've had most open heart surgeries, most types of open heart surgeries. So anybody who had bypass surgery, anybody who had valvular surgery, all these patients qualify for cardiac rehab. And similarly, if we go a little bit outside the heart, for patients who have peripheral vascular disease. So there's some patients who have what's called claudication, which means that when they walk, they get some pain in their legs or in their hips. All these people qualify for cardiac rehab. And it's important to mention, it's not just that they qualify, they actually have a class 1 indication. What does that mean? The way the American College of Cardiology and American Heart Association sort of helps us understand how strong a recommendation is they break it down into different classes. There's a class 1, class 2, class 3. Class 1 is the strongest indication. That means that there is compelling data that these types of interventions actually improve survival and improve outcomes. So for example, I said that patients who have a heart attack qualify and benefit from cardiac rehab, and that's a class 1 indication. And by the way, using aspirin and using statin, cholesterol-lowering meds, are also class 1 indications. So cardiac rehab is as strong a recommendation as some of these other meds. So we talked about many heart disease conditions I mentioned. I talked about heart surgery. I talked about peripheral vascular disease. And the last one I would add is also patients who have heart failure or a weak heart muscle. They also qualify for cardiac rehab. So really, a large portion of patients with cardiac diseases would qualify and would benefit from cardiac rehab.
Okay, thank you. Britta, what are the different types of cardiac rehab?
Sure. So cardiac rehab starts right away. So immediately before or after a cardiac procedure. This could be a stenting, this could be an open heart surgery. The patient will be visited by one of us. So an exercise physiologist will come in and introduce themselves and discuss cardiac rehab benefits, just like Dr. Najjar discussed, as well as lifestyle modification. So it's sort of a mini cardiac rehab outpatient visit. We also do some ambulation, so we go for walks, build up, confidence and balance after a cardiac event. Phase 2 is going to be an outpatient exercise session with us, and that's where you come in, get your exercise, get your education done, and stay with us for about 3 months on outpatient visits, and that's about 2 to 3 times per week, about an hour long each session. Once you graduate from our program, you then qualify for a continued program with us. So this is phase 3, and you are permitted to come in as much as you want. We love seeing our graduates because we love seeing everyone thrive. Or if you choose, the patient can continue their exercise at a fitness center. So multiple different locations around our area or the Baltimore area. I enjoy seeing my patients after they graduate. So I'm kind of biased and I want them to stay with us. So phase 1, inpatient, phase 2, outpatient, and phase 3, medical fitness.
Thank you very much. So Dr. Najjar, what are the benefits of cardiac rehab?
Yeah, that's a very important question, as all the other ones are, because people have studied cardiac rehab for a while, and we've learned that there are numerous benefits from it. Let's start with the obvious ones. So perhaps the most important one is we know that it improves survival. What does that mean? That means that if we take 2 groups of patients, let's say who've had a heart attack or who've had heart surgery, and we put them on all the right medication they should be on, and then some of them undergo cardiac rehab and some don't, those that undergo cardiac rehab are going to live longer. They're going to have a lower mortality. So that's very important. But there's also additional benefits. So we know that people who have cardiac rehab have less recurrence of symptoms, and they have less requirements for rehospitalization. So lower mortality or higher survival, lower hospitalization, less recurrence of symptoms. In addition, there's also more more tangible benefits from cardiac rehab. You're doing exercise, etc., and so as a result, your blood pressure goes down. So if somebody's hypertensive, that helps with blood pressure control. It also helps with lowering your cholesterol, so your cholesterol levels go down. And oftentimes, we're spending a lot of time for patients with heart disease controlling these risk factors. And also, you're exercising, you're sort of doing activity. Well, your weight also goes down. So you're lowering weight, you're lowering blood pressure, and you're lowering cholesterol. These are all sort of very important things that you want to have if you're a heart patient. But also, there are also additional benefits that I want to emphasize. Oftentimes what happens after people develop heart disease is many of them actually develop depression. Now, we don't usually think of depression in the context of cardiovascular disease. We think of them as 2 completely separate things. But what happens is for many people, particularly middle-aged, but even sort of advanced age people, we go along thinking, hey, nothing's going to happen to us because, I'm leading a reasonable healthy lifestyle, until the time comes that, say, we've had our first heart attack or our first heart surgery. All of a sudden, people are confronted with their own mortality because people realize, oh my God, that heart attack, I could have died from that. Right? That's not a thought that sort of crosses our mind on a regular basis. And so all of a sudden we're confronted with that. And there are many people who, because of that, get depressed all of a sudden I have to take new medications. I'm seeing these cardiology doctors or these surgical doctors, which I didn't have to do before. And you'll see that the levels of depression in cardiovascular disease patients are quite high. What we also know is patients who are depressed with cardiovascular disease have worse outcomes than those who are not. And one of the real nice and tangible benefits of cardiac rehab, it actually helps with depression. So people are less depressed. Why is that? Well, on the one hand, because they're going to these sessions, and as Britta mentioned, there's an important educational perspective with it. And with that education, I'm actually learning a lot about secondary prevention. I'm learning a lot about these other risk factors that if they're not well controlled, this is my opportunity to control them. So in some ways, I'm taking ownership of my own health. The second thing is I find out over there, wait a second, I'm not the only one who had a heart attack. There's all these other fun people with me who are going through the same thing. And so we get to sort of potentially, talk, learn from each other. And I'm actually doing something that's enjoyable. That's a social event. And then lastly, let's not discount just any exercise that you do, right? There's a sense of well-being that comes from that. So I think in addition to the physiologic benefits from cardiac rehab, I'd also add that there are also psychologic benefits and a sense of well-being that comes with it, and a decrease in the rates of depression that are also very important, which we don't usually associate with cardiovascular diseases, but there's more and more data that is really linking cardiovascular diseases with depression and psychosocial issues. So these are many of the benefits that you get with cardiac rehab. You're on mute.
Sorry about that. Thank you. I was going to say that sounds like a very holistic approach, not just addressing the physical needs of the patient, but the mental well-being of the patient as well. So thank you very much for explaining that. I want to turn to Britta. What happens during a cardiac rehab session? What usually entails?
Sure. So a participant would come in for cardiac rehab. The first thing we do is get a round of vitals. So same thing that happens in the hospital. We check your oxygen saturation, we check your heart rate, we check your EKG and your blood pressure. So every participant that comes in will be wearing a telemetry monitor. Now we're not going to hook you up to a big 12-lead one that you might be used to at an outpatient cardiologist appointment or inpatient hospital visits. It's only 3 leads. But we want to make sure that the heart is healthy during exercise as well as after exercise. So once we pass all the vital checks, we start the exercise. So about 20 to 40 minutes of cardiovascular exercise, depending on where someone starts. And that could be on the treadmill, it could be on the rower, the cross trainer, the stair stepper, or a bike. So we have a lot of different choices, and we try to work with participants as much as possible. So if you're someone that really loves going for walks and doing the treadmill on an incline, we'll try to stick them on those. On the other hand, if there's something that you really don't like doing, like let's say I'm not a huge fan of the bicycle, I won't put you on the bike. From there, we always do weight training after cardiovascular exercise. So this could be dumbbells. And we have dumbbells as light as 1 pound, because after surgery, someone might be on a weightlifting restriction. And then we have dumbbells that go up pretty heavy. Once you pass the dumbbell check, we then start with machine weights, all kinds of different machine weights, same ones that you would see at the fitness center. And after we get our strength training done, we do some stretching to cool down. So we go through flexibility training with each participant as well. Once you pass our 3-step exercise program, we then cool you down and do another round of vital checks to make sure everything looks good before you get to leave us. Now, during exercise, just like Dr. Najjar was discussing, we do our education. So we talk about, again, nutrition, medication, stress management, but we also touch on different factors for having heart disease. Cholesterol levels, where are they at? Where should they be? How can I get them there? Blood pressure. Again, what does it mean to have high blood pressure or low blood pressure? Or is my blood pressure, if it's good now, why isn't it good when I go home and check it? So we do a lot of education during the exercise. So the participants can't run away from us while we're doing education. So that's what a typical day in cardiac rehab would look like.
Perfect. Thank you very much, Britta. Another question for you. What is your role in helping patients stay on their regimen and be consistent throughout the inpatient to outpatient to the graduate phase?
Sure. So my role in cardiac rehab is similar to that of a physical therapist or a personal trainer. So I'm with each participant every time that you come in, me or one of the staff members. We're there to guide them through exercise. So participants can be as involved or uninvolved as they'd like. So again, if you really want to work on a specific goal, like getting to walk a 5K or maybe riding your bike for 50 miles is the goal. We work with each participant's specific goal. And then also I'm a teacher, right? So I do all kinds of different discussions with patients. And I'm also a case management navigator. So if someone really is interested in nutrition and they want to sit with a dietitian, we refer them to our nutritionist who's one floor above our gym. Or if someone is really interested in joining a specific fitness center, we get them in contact with that. So I have multiple different hats on for all of our participants, and I really enjoy it.
Awesome. Thank you very much. At this time, I want to pause and welcome our viewers again. If you're just joining us now, thank you and welcome. Today, we're going to be discussing cardiac rehabilitation, its benefits, and how it can help those with heart disease and those who have had a heart attack. With advanced heart failure cardiologist, Dr. Samir Najjar, exercise physiologist, Britta Heiss, and Cheryl, a recent cardiac rehab graduate. We have more to talk about, so keep on watching. Give us a like to let us know that you're here. And if you have any questions along the way, be sure to share those in the comments below. We're going to take some time to answer those as well. All right, so at this time, I want to turn over to Dr. Najjar. Could you explain what's the importance of cardiac rehab and who especially benefits the most from this program?
The importance of cardiac rehab is, even though it's not traditional medications, right? We usually think you go to the doctor, you get either a shot, particularly if you're a kid, or you get a medication if you're an adult. And that's how we usually think of what happens. Or somebody can take, can do surgery on you or something like that. But cardiac rehab is actually one of the forms of treatment. And so it's as important as some of the medications that we are mentioning. Now, it's a lot easier to pop a pill in the morning and go on, as opposed to cardiac rehab, where you have to worry about, okay, I gotta get in the car, get to the place, do the exercise, and come back. And so we don't think of it as a form of treatment, but it is absolutely a form of treatment. And as I mentioned earlier, it is actually, for a lot of these cardiovascular diseases, it is a class 1 recommendation, meaning we have ample data to support that cardiac rehab after you've had a heart attack, or after you've had a stent, or after you've had cardiac surgery, or if you have heart failure, is actually going to make you live longer and lower the chances of you having symptoms again or getting readmitted to the hospital. But in addition, not only is it a treatment, right? So if you've had an event or you've had an issue, we're now treating you because you've had it. Think about it also as prevention. Because when I say you have less risk of ending back up in the hospital, less risk of having another set of symptoms, you're actually preventing a next event from happening. And so it's both a treatment and a prevention. It's 2 in 1, and it is very important, which is why we strongly recommend and endorse it.
Great, thank you very much. So why doesn't every cardiac rehab patient why doesn't every cardiac patient go to cardiac rehab? Are there any instances in which cardiac rehab is not the best mode of treatment after a cardiac event?
There are, before you go to cardiac rehab, you want to make sure that your physician is prescribing it and they're approving it, because sometimes there may be a few things that still need to be treated. Let's say that you have a blockage in one of the vessels of the heart. They want to get a chance to do the angioplasty to open that blockage before you get released to go to cardiac rehab. If you've had surgery, you want to give it enough time for, if you had heart surgery where they sort of open the chest up, they want the chest bones to heal before they say, okay, you're good to go to a phase 2 or a phase 3 cardiac rehab. So there are certain situations where a person may not be ready yet. But I want to blur the line a bit, because you asked the question, why shouldn't all heart patients go to cardiac rehab? I'm going to ask the question a little bit differently. Why shouldn't everybody go to cardiac rehab? Because if we think back 10 minutes ago when Britta was describing to us the phases of cardiac rehab, she said something very important. She said there's phase 3 cardiac rehab, right? Which is actually, in some ways, I mean, if you do it in a formal rehab space with the exercise physiologist, et cetera, that's a phase 3 rehab, but it's not that different than a person doing exercise on their own, right? Or at their gym. I think that when we think about risk factors for cardiovascular diseases, so let's go 2 steps back. We think of the classical risk factors, right? What are the risk factors? It is high blood pressure, it's high cholesterol, it is diabetes or high sugar, right? It's smoking, it's obesity. These are all the risk factors that we think about. What we don't think about is there's a 6th risk factor that goes along with that. It's sedentary lifestyle. We as a society are very, very sedentary. And I think COVID didn't make it better, right? Because many of us are now sort of at home all the time. And so we have to do even less than we did before. And so we are used to our sedentary lifestyle. So, in my hospital here, I see people all the time. They go from one floor to the other. They take the elevator. So just for one floor, people are taking the elevator up and even taking it one floor down. I mean, even think about going down the stairs for one flight. That's not a big deal. Go to the mall. I mean, in the mall, I watch this all the time. I shouldn't say people, I put myself in that category. We take the escalator to go from one floor to the other. You're standing there and watching things around you as people are walking, instead of taking those stairs that are sitting between these 2 escalators being unused. And my favorite one is when we go to the gym. Many people go to the gym. And what do we do when we go to the gym? We drive to the gym, and then we try to find the parking spot that is closest to the door so we can enter the gym, so we can exercise inside the gym. So I think in general, we as a society are a very sedentary society, and a sedentary lifestyle is a very strong risk factor for adverse heart diseases and heart conditions. So I think that we all should be thinking about being more active. That's cardiac rehab. Just be more active. And what I tell everybody is pick an activity that you like, because it's not about being active for 1 week or 1 day or 1 month, or, a lot of my patients tell me, 2 days before they come to see me in clinic, I started my treadmill, 2 days ago, because they knew they were coming to see me, and then they will not do it again until 2 days before they come to see me at the next appointment. The key is you want to put yourself on some form of activity regimen that is sustainable, that you can do it for a long time, which means it's something you have to like. And everybody's different. Some people like to walk, some people like to bike, some people like to swim, some people like to go to the gym, you name it. Find the activity that you like and commit yourself to it. It is very opportune that we're in the mid-December, and so we're coming to the sort of end of the year. And I would hope that all our listeners not make a New Year's resolution, but a full year's resolution of saying, I want to be active for next year, and let me think about what is the activity that I like, and let me do it. Let me do this activity. That is going to be an incredible investment in for your health. Now, I know, listen, all of us are uber busy. We're all super busy. We got all these things we have to do at work, and then we have all the family obligations, and it is hard to find the time. I understand that it is very hard, but what I like best is ask anybody about, what is your favorite Netflix series, and they'll rattle off the last 10 series that they've watched and tell you about how you get captivated, and then you start binging and watching several episodes in a row. Well, if we can do Netflix, we can certainly invest 30 minutes of our time to do some sort of activity. And by the way, they're not mutually exclusive, because you could be walking or doing something while you're watching your Netflix show. And hey, let me not be a hypocrite here. I am forced to be sitting here in front of the camera, so I can't move. But for those of us who are listening and watching us, you could be standing up and doing either walking while you're doing it, or doing your step activity doing that. So I think we can find the time if we're really investing in it. And oftentimes people will tell you, starting is the hardest part. After a couple of sessions, then you get hooked on it, and then people sort of don't want to stop it. But then when you stop, you fall into this vicious cycle again. So, but getting started is the hardest part, and let's make it our full year's resolution to do it. Let's all get healthy. This is something that is under our control. We can control it. You can't control your genes. There's some things you can't control. I can't control my blood pressure. Sort of personally speaking, you can do medications to control it, but it's not something that I necessarily cause. But investing in our healthy lifestyle is really critical. So for that reason, I'll answer your question by saying every single one of us should be enrolled in our own personal active lifestyle, which is the equivalent of a cardiac rehab program. So that's my long-winded answer to your short question.
No, I think that is great advice that I think we all can take from this broadcast, not just for people who have had a heart attack or heart disease, but everyone. We should, do our part to stay active for our personal health. And I got to say, when I did go Christmas shopping at the mall last week, I did take the stairs, so I feel pretty good about that. I'll keep doing that and park farther away. So thank you, Dr. Najjar. I think that's a great segue to talk to Cheryl about your experience as a recent cardiac rehab graduate. So were you hesitant to start cardiac rehab, and why did you make the decision to start? And once you did, was it hard to, stay committed?
Okay, so after listening to these two, I would feel like a complete doofus, not saying like, oh, I loved. Okay, you pretty much had to yell at me and drag me there. No, I did not want to go. So I think hesitant is an understatement. I already had this event. I'm already feeling really vulnerable. The last thing I honestly wanted to do was to put myself out there, especially in front of a bunch of strangers. To be honest, I wanted no parts of this. To Dr. Najjar's point, like, I know what to do. You need to exercise, you need to take the stairs. I know all that. Why do I have to go to cardiac rehab? And so, I was a little bit hesitant, and I'm sure Britta, cringed every time she saw my name on the list coming in. But I did because I had a really long discussion with my physician, and because honestly, I could rationalize and many of these things that Dr. Najjar just mentioned. I mean, because I can tell you why you watch Netflix and go instead of go taking a walk, because I'm exhausted. I'm emotionally exhausted from work. I'm emotionally exhausted from taking care of a family. I feel like I do enough in a day. Why do I have to go do that? And so it really was actually interesting because it was somebody telling me, you deserve it. That's why. Because you deserve to take care of yourself. And that was kind of interesting, right? That was a different flip on it. It wasn't so much me going because I had to go, right? As much as it was kind of like when you go and buy something really nice that you wanted. It's kind of the same idea. Suddenly it's like, oh, I'm doing this for myself. And for the record, that didn't work all the time. You know what I mean? But it did get me there to start. And I thought, you're right. I deserve this. I want to see my grandkids. I want to see my kids grow up. I want to see these things. And so, yes, ultimately I did, commit and promise to go. And, I don't know if we're going to talk a little bit later, but, about what a huge difference it actually made, because I actually did, much to, I'm sure, Britta and the other staff betting against me, especially after the first one. I actually did stay to the very end, and actually created very much a different lifestyle. And it did not happen overnight. It was not a New Year's Eve thing and starting tomorrow, I'm going to be the best ever. It took me every bit of those 3 months to get myself in gear. And to make the changes that I needed to make and to really get on the right path. But it's been a while now, and I still walk every single day, and I still feel great.
Great. It's good to hear that. And thank you very much for sharing and being honest and transparent about how you did feel starting out and how it's been going along the program and eventually graduating. So thank you very much, Cheryl. I have a question for Britta. Is cardiac rehab covered by insurance?
Yeah, so first off, every participant that comes in, we always verify with insurance prior to them coming in. We want to make sure that you're covered first and foremost. And if you're not covered, what percentage would you be responsible for? We want to be as transparent as possible because we do know financial considerations are a concern. speaking on that, so we do verify prior to coming in. There are most of the cardiac events, heart procedures are covered by cardiac rehab. But if you have a specific question about something that maybe not Dr. Najjar didn't discuss, you can give our office a call, and any cardiac rehab program within the MedStar universe would be able to answer those questions.
Thank you very much. I have a question for Dr. Najjar. This comes from one of our audience members, Debbie. She's asking, would this program, would cardiac rehab also work for someone who has had HCM or hypertrophic cardiomyopathy? Does that also work for HCM patients?
Yeah, thank you, Debbie, for this question. For the rest of the audience, hypertrophic cardiomyopathy is a form of genetic heart disease. It's actually the most common form of the most common genetic disease that comes in the heart. And it comes in many different flavors. And so certainly, Debbie, before committing to cardiac rehab, you want to see your cardiologist and make sure they're okay with referring you. And if that's the case, depending on what your underlying symptoms or what's going on, it could very well be helpful. But I would check with the cardiologist first, because there are certain things with hypertrophic cardiomyopathy you want to make sure they're taken care of before you enroll in a exercise or rehab program.
Thank you very much. I have a follow-up question, Dr. Najjar. When is it best for physicians to refer their patient to the cardiac rehab program? Is it directly after, or post-op or post-surgery? When is that decision made?
Yeah, it depends on what is the underlying condition. So, for example, if somebody has heart failure, what we want to do is we want to get them. Heart failure, oftentimes people retain a lot of fluid. And so we want to make sure we get all that extra fluid off of their body before they're referred to be able to go and participate in the cardiac rehab program. If people have had stents or heart attacks, there's certain timing after you've had the heart attack before you want to go there. If you've had cardiac surgery, then we usually wait until, you get a phase 1 cardiac rehab while you're in the hospital, but before going to the other phases, the surgeon wants to make sure that things are well healed. So when a person is referred will depend in part on what kind of condition that they have. But one interesting thing is that, cardiac rehab is not, and I was talking earlier how we don't think about it so much in terms of standard treatment. And I wasn't just talking about the lay people, the regular audience. I'm talking about even us, the professionals in cardiology and in cardiac surgery. About 10 years ago, there were a lot of studies came out how only 20% of patients who would qualify for cardiac rehab were actually being referred to cardiac rehab. So there was a big push in terms of sort of trying to convince the physicians and the healthcare providers about the importance of this therapy. And we've made some progress. As of a couple of years ago, now that number is 60, 70%. It obviously varies a lot depending where you are and both in the country and within a region. So we're doing much better about referring patients, although not perfect. But then the next level of complexity comes in is even among those who are referred, maybe only a half or a third actually do go to cardiac rehab. And Cheryl brought up an important point. Of those who do show, the majority are not necessarily staying for the duration of the rehab. And that's something that people are working quite a bit on, because when you break it down, there are numerous reasons why that is the case. Many people, you've had your heart attack or you've had your stent or your angioplasty procedure, and you got to go back to work. And being able to sort of, say, well, I want to go 3 times a week and make it over there to the cardiac rehab may not necessarily be convenient. You may be worried about, will my insurance cover it or not, as Britta just answered. What is my copay? How much time can I take off from work? Do I really need it? Am I truly motivated to do it? Did my doctor really tell me how important this was? Because maybe I think this is an elective thing. Hey, if you have time, do it. If you don't have time, make sure you take your aspirin. So I think that, the thing that's happened with COVID, as all of us have been touched by it, is we learned that we have to start thinking a little bit outside the box. And there's a lot of research being done now from a cardiac rehab perspective is, do we keep using the same model we used before, or let's look at additional novel, newer models of how we can do cardiac rehab that will encourage people to participate, A, show up, B, participate, and C, for the duration of the program.
Along the lines of your the previous question, who does the referring? Is it mainly the cardiologist or the cardiac surgeon? Can your primary care physician do that? Who refers the patient to cardiac rehab?
The short answer is yes. And anybody can refer to cardiac rehab. I'll turn it over to Britta in a second. It tends to be the cardiologist because they've done a procedure or they've seen them when they've had a cardiac event, or the cardiac surgeon because they've done the surgery, so the cardiac surgery team could refer. But I think it doesn't have to be restricted to those people. Any other physician in any other specialty, any other healthcare person, they don't have to be a physician per se, could make the referral. And I'll be interested from Britta to hear where the referrals come from mostly.
Most of our patients do come from their cardiologist. The cardiologists are most familiar with cardiac rehab. We do get maybe about 20% get referred by their primary care physician. And then you get the straggler who gets referred by their surgeon every now and then. But most of our cardiologists are our referring source.
Thank you very much. I have another question for you, Britta, this time. When do you consider someone ready to graduate from the cardiac rehab program? What stages must they have gone through in order to move out of that program?
Sure. So we look at cardiac rehab program two ways. One, our goals, so my goals for my patients, and then patients' goals. Have they achieved their own personal goals? This could be returning to a 5K, being able to walk up 2 flights of stairs without feeling short of breath, drinking enough water. Are they hitting 100 ounces of water every day? It could also be reducing cigarette consumption, reducing alcohol consumption, caffeine consumption. So once they hit their own personal goals, and then our goals. So our goals, first and foremost, will always be continued healthy lifestyle. So do I feel confident that this person's going to continue exercising once they leave us? Do I feel confident that they're going to continue eating a healthy diet when they leave us? And then also making sure that they feel comfortable continuing with their cardiologist or referring physician and following up with appointments, making sure that they're staying on the path of a heart healthy life. So once they hit their goals as well as our goals, and 3 months is the general guideline, we feel that they're ready to graduate.
Thank you very much. I like that you guys not only include the physiologist's feedback and requirements for the cardiac rehab program, but also, asking the patient, what is it that you want to accomplish and how do you want to achieve? What does a healthy lifestyle look like to you? So I like that you include the patient's input as well. I think that is a great segue to Cheryl. I want to ask you, how did you feel at the beginning of cardiac rehab and during and towards the end? What was it like to go through those stages? And you've been through this experience. So what was that like for you?
So I will tell you, it was a 180 from beginning to end. Okay. So like I said, going in, I think I was very honest in saying I felt very vulnerable. I knew I was not in good shape. Don't ask me to set a goal of a 5K because that was not going to happen, and so I was already a little bit overwhelmed, just starting. Yeah. So I think that I also was really, how was I going to do this? How was I going to fit another hour into my day? And it actually stressed me out a little bit, right? And so I think what happened though was, yes, I made the commitment and I did it. I will tell you again, I didn't go right away, like, can't wait to do this, but, and it didn't happen right away. The first month, it was clearly chipping away. Month 2, I actually really started noticing it, but I'll be honest, I didn't notice it so much in my weight or something like that as I did in my mood. I actually just simply felt better. And then I realized I probably feel better because I'm sleeping better. And then things started to click a little bit. And I will tell you by the end, that was what I really got out of it. What I got out of it was it was a combination of all of those things, right? And it was eating well. And I'm not saying eating perfect. I'm saying eating well, eating doing things in moderation. It was about making sure I got up and moved. And I'm pretty really good about that now. And understanding to take that time for myself. And what I found on the back end that I really did not expect, you do these things because your doctors tell you, and it's going to make you feel better, and you're going to have, less chance of heart disease, or at least progression of it. But that's not actually something that's tangible for me to see, right? What I felt was, wow, I actually feel better. It's easier to move. And I actually feel good walking. And oh my gosh, at the end of the day, I'm not just emotionally exhausted. I'm actually pretty tired and can get a good night's sleep. And I don't know about like people in the audience, but I'll tell you with me, if I can get a good night's sleep, I can do anything the next day. Do you know what I mean? But after the end of the week, when you don't sleep well, and you know what I mean, by the weekend, we're all dying for the weekend, right? To catch up on our sleep. I found that that's not a problem for me anymore. And I will tell you that that has been a problem for years and years, right? When you have a stressful job and just the regular stress of family life, you go to bed, but you're not rested. You're thinking about a million things in your head about what you need to do tomorrow and what things are happening. I found out when you exercise, and again, eat well and exercise, when I went to bed, I was ready to go to bed, and I actually got a good night's sleep. And then you get a good night's sleep, you can come back ready to go again tomorrow. It was, so that was the real benefit I got out of it. All the other things were like a topping, right? I mean, they were just topping on that, because when you go to the doctor and they actually take your cholesterol, they're happy that your cholesterol is lower. I just kind of figured it would be. Do you know what I mean? Because like now I'm doing all the right things. So to me, that was like, well, yeah, you know what I mean? I'm doing the right stuff. But that, like I said, but what made a difference for me in cardiac rehab wasn't just all those numbers. Those numbers automatically fall into place. What I felt really great about and still feel good about, and the reason I still exercise every single day, and have my iWatch and look for 10,000 steps. And I do it every day because it makes me feel better, and it makes me feel better. And then it makes me sleep better. And then I think that makes me a better employee. It lets me think, right? It helps me to be more creative in my thought process. It helps me to be nicer to the family. So I think it helps you to be a nicer person. So hopefully, I don't know, you should ask Britta, because like, was I nasty when I came in? And then I was definitely nicer when I left. But yeah, I mean, I think those, and I think Dr. Najjar touched on it, but it isn't just the things you can point out and say will get better. It's actually those less tangible things about how you feel. And that's really what I learned about it. And that's why I'm really glad I stuck it out. If I hadn't gotten past that first month, I'll be honest, I would not be out there walking every day. I needed somebody to hold me to it. I needed to commit for the whole time. And that is a big part of what really changed for me.
So Cheryl, piggybacking off of what you just said, what advice do you have for patients who have just enrolled in cardiac rehab, or who are considering it and maybe hesitant? What would you say to them?
So I think cardiac rehab is, I think you need to do it. And I think you need to, okay, let me speak for myself. Stop fibbing to yourself. We all know you're supposed to go walk or exercise. So if you already know that and you're not doing it, why? And if you weren't doing it before, what suddenly is different about it? You know what I mean? So you can talk yourself into it. But for me, it was my physician. I was a little bit of a head game, I'll agree, but you are worth it. And you deserve this. And it was a help. It was them being able to help me when we, especially just speaking as a woman, as a mom, are so, and not that every male and dad and everything isn't used to helping others. It was hard to find that time for myself. But I would say that was the other big thing is it's easy and I can be sarcastic and like push off. And yes, you know, Dr. Najjar is correct. We find time to watch Netflix, but you know what? It's easier, quite honestly. I would say to you, you are worth it and you need to commit to that hour. Even if it is, you know, walking and moving in front of the television while you're watching Netflix. But it is, I mean, on the one hand, it's easy to say and it's also easy to dismiss, but it's really worth it. And so find the time, make the time for yourself because you're worth it. Don't try to do everything at once. Don't beat yourself up. You get enough of that. You change your diet, you find out what feels good. And the better you feel, the more you'll want to do. And the more you want to do, then the better you feel. It just is it just is a self-fulfilling type thing. So I would say go for it. You have to start. And I would say go to cardiac rehab. The one time, and Britta probably knows, because there was one time actually, and if I'd done it on my own, I would have stopped. But I was on the elliptical, which I lovingly refer to as the torture machine. And she made me get on that thing. And one day I started having what I thought was chest pain. And it was a really fabulous thing to be, to have the telemetry on so that I could say to her and they could look at it and know in real time that's not what's happening. And you know what I mean? And they stopped and checked my blood pressure and did all that stuff. And then I got right back up and started again. And I felt much better knowing that was not another event. And I think if I'd been on my own, walking around the mall, doing whatever, and I'd had that feeling, I would have stopped. And I don't think I would have gotten back up on that elliptical and gotten back up and moved again. It was really with their support and the support of the people around me and knowing that they were keeping an eye on me, that suddenly I was walking more than I ever was. I was lifting more weights. Which by the way, I started out at 3 pounds. You have to go up from there. Okay. And it was not about open heart surgery. So it was really good. And it was very reassuring to me to have somebody watching me for that full time. And then to get to like this place where I feel like, oh, I can do this. I can do this now by myself. I feel comfortable doing this by myself. So I would really encourage people to go. And like I said, there's a lot of different reasons why different people should. But for me, again, it was a little bit of a safety valve. Once I got over being vulnerable, it was definitely, the truth is it was a safety valve. And if I'm being honest to myself, I would tell you, I would not have kept it up if I had not sustained the 3 months with them.
Thank you very much, Cheryl. I think you just shared some really valuable advice. Do this because you're worth it. You deserve to be healthy. You deserve to live a fulfilled life and do the things that you want to do. And in order to do that, you need to be healthy enough to stick around and to do them. So thank you very much. I think that was really helpful for a lot of our viewers. At this time, I want to ask Dr. Najjar, what would you like physicians to know about cardiac rehab?
As we mentioned earlier, within our field, there's an ongoing educational effort so that physicians truly understand the extent of the benefit of cardiac rehab and why it's important not just to refer patients, but it's also important to talk to the patient and explain to them why it's important. I mean, Cheryl brought up the point in her really touching and moving story that it started out with a discussion with her physician that got her there. She didn't just get a piece of paper with a prescription saying go to cardiac rehab, and she sort of picked up the phone and made an appointment. And this discussion becomes even more important when you hit that wall. Cheryl told us a story. She kind of hit a wall at one point, right, in that first month. And in her case, it was with talking with herself and talking with her physician and talking with the cardiac rehab people. Sometimes you do need to give that nudge, that push, to sort of sustain it, because it's not just about first you got to go and you got to start it, and then you got to sustain it. And so I think it's important that all these be explained, that people truly believe in their heart of hearts that this is an important intervention. And I'm calling it intervention because I want to keep harping over and over and over and over again that it is a treatment for somebody who's had an event, but it is also a preventive strategy for somebody who hasn't had an event yet. Don't wait until you've had your event to start thinking about these. That's how most of us do it. We wait until something happens, and then we start all this. And by the way, I've had a lot of people tell me, Doc, I did all the right things. I watched my diet. I didn't smoke, etc. And I still had a heart attack. And then I always tell them, well, yes, but you had your heart attack at the age of 72. Had you smoked and not done exercise, you would have had it at the age of 61. And so do the right thing now. We're not talking about completely eradicating these cardiovascular diseases. We're talking about preventing them, preventing how bad an event is when it happens, or delaying it as much as possible.
Thank you very much. I think that's really good advice. Thank you very much, Dr. Najjar. One follow-up question to you, to Dr. Najjar. What would you tell patients who are hesitant about doing cardiac rehab? What would you say to them, and in order to convince them that this is a good decision to make for your health?
So I'll tell you in a second what I'll tell them, but I'm going to tell you what I'm going to say starting from today. I'm going to take this recording. I'm going to have them listen to Cheryl tell her story, because I think hearing her story is much more convincing than hearing a person with a white coat telling you about all the numbers and the statistics and this, that, and the other. Because I think the point that she made about the stuff that a person cares about is much more important than a person. People don't walk around saying, I wonder what my blood pressure is now, I wonder what my cholesterol is now. They worry about it that 1 minute when they're with you in the clinic once every, I don't know how many months. The rest of the time, they don't walk around thinking about that. They walk around thinking, how good do I feel? How is my emotional well-being? I think those things matter a lot. And I think there is, the Cheryl's words, and just seeing her on screen and hearing her say that story was way more convincing, way more touching than anything that a white coat will ever present to you. Having said that, I think what I would tell the patient is pretty much what we mentioned today about why it is important to do the cardiac rehab. This is, we're not doing it just to be inconvenient. We're not doing it just because we want to make your life more miserable, or because we're trying to find ways to twist your day and make it harder to accomplish those things. We're doing it because, number one, there are the physiologic benefits for cardiac rehab. Number two, as you also mentioned, there are also these the holistic approach to a person and the emotional state and the emotional benefits that you get both from being in a rehab program and from doing exercise. And don't discount what Cheryl mentioned also about that there is a safety element. So I've just had a cardiac event. I had a heart attack. I had an angioplasty. I'm kind of scared. What if this happens to me again? When would this happen to me? And what if there's nobody around? What if there's nobody around to call 911 or help me out? And so I'm going to be scared to be going out there and starting this on my own. And if I have those same symptoms I had before, the first thing I'm going to think about is, gee, am I having another heart attack? As you should, because you should not discount symptoms. But when you're in a cardiac rehab program, you're in a monitored setting. Not only are there professionals around who are watching you, you also have monitors and we're testing, we're checking your blood pressure, your heart rate, et cetera. So I think all these are going to give you the confidence. And then thirdly, as I mentioned before, and as Cheryl mentioned, ultimately, we're not talking about just that small period of time when you're doing the cardiac rehab. We are talking about lifestyle modifications, and we do not have time to go over this. In addition to changing your sedentary life patterns, then we can have a whole discussion about diet and all the other stuff. So I think it's all about a person's life. And I love what Cheryl said. She said, because you are worth it and you deserve it.
Exactly. Very well said. Thank you very much, Dr. Najjar. We have a few minutes left, but I want to get to a few of our audience questions really quick. My first question comes from Wayne. I think Dr. Najjar, you could answer this question. He says, does cardiac rehab help diminish chest numbness?
So chest numbness is something that oftentimes happen after cardiac surgery. The reason for that is during cardiac surgery, during open heart surgery, what the surgeons are oftentimes doing is they're actually, opening the chest bones and then doing the surgery on the inside. Then they're closing them, and so it takes a while for the nerves to sort of regenerate, and that takes a while. And oftentimes it gets much better. It doesn't always completely go away. And for all the benefits that we said about cardiac rehab, that's one thing that cardiac rehab is not going to necessarily improve per se, but the person will see other people with them who had cardiac surgery who are probably going to say the same symptoms. And oftentimes what you hear people saying is either you get numbness there, and sometimes the symptoms, either the numbness or that little bit of residual chest pain, is worse when the weather is cool. And cold weather, it kind of makes it more you feel it more. So I think this is something that will take time, and the cardiac rehab in and by itself doesn't help. But don't forget, an important part of the cardiac rehab is the educational training. And so people will learn about a lot of the secondary preventions or a lot of the risk factor modifications, and they learn about these types of interventions that we did and what are the long-term effects from them.
Thank you very much, Dr. Najjar, and thank you, Wayne, for sharing your question with us. I have one last one from Betsy. I'll direct this to Britta. Where are you located? Where within MedStar Health can people enroll or be referred to the cardiac rehab program?
So I'm located at Union Memorial, which is the MedStar Hospital in Baltimore. And then we also have another one, Good Sam in Baltimore. And then Franklin Square is also another location. And all three of them follow the same protocol. So wherever, if you walk in one hospital one day and the next hospital another day, you'll be doing roughly the same exercises. So a couple different locations that you could attend.
Perfect. Thank you very much for your time. That wraps up our broadcast. I'd like to thank Dr. Najjar, Britta, and Cheryl for spending time with us today and sharing your expertise and sharing your experience as well. Thank you very much to our audience members for joining us and tuning in and sharing your questions with us. We really appreciate it. For more information or to schedule an appointment, please call 410-554-2167. We're going to include that number as well in the comments for you. So thanks again, everyone, and we will see you next time. Bye.
Thank you.
Thanks, everyone.
Bye.
Thank you. Bye.